Assalamu alaikum. Good day to all of you, dear doctors. Today, I'd like to share a brief discussion on perforated gastric ulcer, which is both important for both part of MRCS examination. As the term is Middle East man with osteoarthritis taking non-steroidal anti-inflammatory drugs and presented with vomiting and peritonism. X-ray shows the pneumoperitoneum. That's the most likely diagnosis is perforated gastric ulcer or duodenal ulcer. Uh, X-ray shows here air under the diaphragm on right sides. The risk factors includes in perforation. Here are non-steroidal anti-inflammatory drugs, Helicobacter pylori, steroids, previous peptic ulcers or malignancy. Now, I would like to share about the brief discussion on how NSAIDs causes peptic ulceration or pathophysiology of peptic ulcer. First, the topical irritant effects on the epithelium and impairment of the barrier properties of the mucosa. Suppression of the gastric prostaglandin synthesis or inhibition of the cyclooxygenase, and it occurs due to reduction of gastric mucosal blood flow and interference with the repair of superficial injury. Now, the management options of perforated peptic ulcer is ABCD resuscitations or NPO, gastric suction, resuscitation by IV antibiotics, and intravenous PPI or intravenous analgesics. That's also including urgent laparotomy after consent, and if the perforation is less than 1 centimeter, then the management is omental pace repair, good peritoneal toilet, and intra-abdominal drain, perforated gastric ulcers. If the lesion is greater than 3 centimeters, here's the gastric resection is done, and lastly take a biopsy to rule out malignancy if the perforation is greater than 3 centimeter gastric resection. Post-operative medications are given is long-term PPI. Now, mechanism of the PPI is the PPI binds irreversible to a hydrogen or potassium ATPase enzyme on gastric parietal cells and blocks the secretion of hydrogen ions, which combine with the chloride ions in the stomach lumen to form hydrochloric acids. Other medication used in peptic ulcers are receptor antagonists such as ranitidine, anticholinergics such as pyrenzapine, and prostaglandin analogs includes misoprostols, plus anti-spirally drugs such as amoxicillin and clarithromycin. Actions of hydrochloric acid is it activates the pepsinogen to pepsin and provides acidic medium for pepsin to work. It acts as antimicrobial and it helps in absorption of calcium and iron in small intestine. It promotes pancreatic, small intestine, and bile secretions. Here's three phases of gastric secretions are cephalic phase, gastric phase, and intestinal phase. In case of cephalic phase, here smell and taste of food is related. Here's 30% of acid is produced. Here's vagal cholinergic stimulation causing secretion of hydrochloric acid and gastric release from G cells. In case of gastric phase, distension of stomach, here occurs 60% acid is produced. Stomach distension and low pH and peptides causes gastrin release. And lastly, the intestinal phase for food in the duodenum, here only 10% acid is produced. That's high acidity and distension, and hypertonic solutions in the duodenum inhibits gastric acid secretion via intragastons such as cholecystokinin and secretins, and neural reflex. And lastly, we would like to share some national confidential inquiry on into patient outcome and death interventions classifications. Here's some categories of divided such as immediate, urgent, and expedited and elective surgery. Here's immediate surgery occurs within 6 hours, such as it means to 6 hours, and such as ruptured aortic aneurysms and major trauma due to abdomen or thorax fracture, fracture with major compartment and compartment syndrome. And in case of urgent shares done within hours of decision to operate, and normally once resuscitation completed. First includes the compound fractures and perforated bowel with peritonitis, critical organ or limb ischemia, acute coronary syndromes, and perforating eye injuries. That includes debridement and fixation of fracture, laparotomy for perforation, coronary angioplasty, and expedite. It is done within 2 to 3 days, and such as tendon and nerve injuries, stubble and non-specific patients for a wide range of surgical procedures, such as retinal detachment and fracture which are not open, and acute cholecystitis done within 2 to 3 days. And finally, the elective feature, it is planned surgery, such as encompasses all conditions not classified as immediate, urgent, or expedited. That include elective abdominal aortic aneurysm repair and laparoscopic cholecystectomy, varicose vein surgery, joint replacement, and coronary angioplasty are done electively. Here's all of the today. If you have any further questions, feel free to ask me. Good luck, dear doctors. Thanks all of you for watching these videos.